Hi, everybody. I'm Diane Cohen with MacroPro, and I'd like to welcome all of you to this edition of MacroPro and Friends webinar. We are excited to be here with you today. MacroPro provides these educational programs as part of our service to our community and to our clients. Before we get started on our very important topic of the long-term consequences of COVID-19, I do have a little bit of housekeeping that we need to take care of. The first being that this seminar is worth 1 CEU credit. In order to get it, you need to make sure that you are logged on with your computer. If you are logged on only with your phone, you will not be able to receive your credits because GoToWebinar will not be able to track your attendance. So please make sure that you log on with your computer and not just your telephone. You will be receiving your certificate within the next 3 hours, so be sure to keep a copy for yourself and provide one to your employer. Now, today, we are going to leave time for you to ask questions of our doctor. So please be sure to use the question portion of this webinar so you can ask questions of doctors, and there will be 3 of us reading those questions, and doctor will try to answer as many of them as possible. We have handouts that are going to be attached to this, so we will have that available to you. So please download them. Not everything is going to be on screen today, but there will be information in the handouts for you as well. And there will be an encore presentation of this for you to watch on the MacroPro channel. Now, I'd like to introduce my first guest. My first guest is Leslee Schoenberger, and Leslee has been with First California Physicians. She draws with over 30 years of experience. She has been working with doctors for many years, and today we're going to talk about all of the different things that patients do experience with COVID. And she's going to talk about the type of doctors and specialists that would be necessary for them, because people who have had COVID may need to see a variety of doctors. So Leslee, we thank you so much for bringing your expertise to us today. When we're talking about the symptoms of COVID, I think most people know what those are, but now that we're getting back into our office buildings and people are again with co-workers, can you talk a little bit about the emergency signs of COVID and the symptoms?
Sure. If you're experiencing increased chest pain, increased coughing, shortness of breath, changes in color of your skin around your face, or your fingernails blue or purplish, or you have a hard time staying awake, or you have more confusion than you've had, you need to get to the emergency room immediately.
You know, I think it's important for us to know and see this, because I think that people need to be aware of these things as well now that we're back in the offices, in case they see something in a colleague. When we hear people talk about COVID, we hear a lot about anxiety and fear. So if you're a claims examiner, and the idea today is if you're a claims examiner and you're handling these cases and a COVID patient tells you certain things, you may not know where to direct them. So Leslee's here to talk to us about the different type of doctors that we might want to send our injured workers to. Let's talk about fear and anxiety, because a lot of COVID patients have that. Who would they see?
With fear and anxiety, if it persists and it becomes a bigger problem, then we would speak to the adjuster, work with them within their MPN, and send them to a psychologist that could help them work through those problems, through the issues that they're having, and move forward with their life.
And what about chest pains?
Chest pains is normally a cardiologist that we would send them to, just to get a cardiac workup to make sure that everything is good, that there's nothing new going on.
Yeah, because I imagine that is so scary to have chest pains, and to have anxiety on top of that would just really be an awful thing to experience. One of the things we do hear a lot of is that people have loss of taste and smell. Is that something that goes away? Or
Well, sometimes it comes back in 5 days, 7 days. Sometimes it doesn't come back for a year. I think Dr. Bondade will touch a little bit on that, in the sense that you can retrain your senses to get them back to a certain degree.
muscle and joint pain, would we see the same doctor for that, or would that be something different?
No, back pain is a very common symptom with COVID. And if the back pain, joint pain, muscle pain is persistent and keeps bothering the patient for quite some time, we'd send them to an orthopedist just to make sure that we don't have something else going on that we're not addressing.
All right, and then fatigue. That's something we hear a lot of. We hear that people used to be able to climb mountains and do, marvelous things, and now they're just so exhausted. What will we do for a workers' comp patient that has that?
Well, with fatigue, there's different things that they can do, but fatigue is one of the biggest complications of COVID, along with brain fog. Those two things can cause the patient some distress, and it takes a long time to work through. Dr. Bondade normally will run multiple lab tests to find out if their levels are at the right place or if they're lacking in certain areas.
Very good. Now, I see here that one of the things we have listed, that you have listed, is wellness clinics. What would one go to a wellness clinic for?
Well, the wellness clinics basically for the hair loss. Hair loss, you can do a lot of things over the counter. The hair will come back eventually, but they also are doing what's called PRP, which is a platelet-rich plasma. And they draw your own blood, spin it down, get your plasma, then they inject it into your hair follicles. And what that is, what that does is basically it stimulates your hair follicles to grow new hair.
It is fascinating to see how many doctors one would have to see. All right, well, let's bring on Veronica Herrera, who is our guest today. And Veronica has had COVID. Veronica has been part of the workers' comp industry for many, many years. And Veronica, we want to thank you so much for sharing your story. A lot of us don't necessarily know somebody that has had COVID, and being somebody that is visible in the industry, I wanted to bring you on so you can share your story. So can you tell us a little bit about what you experienced with COVID?
Sure. So I contracted COVID early November 2020. So before my positive COVID test, I was experiencing what I thought were allergy symptoms: runny nose, sneezing, nothing too serious. And I didn't get prompted to go get tested until I lost taste and smell. So once I did that, I went in, got a test. It was positive, and I recall the doctor telling me, even before the positive result, she said, definitely is COVID. So the first 3 days were going to be critical for me. So if any changes, new symptoms started, then I would either have to go to the hospital or keep quarantining. So that's when fear and anxiety started to set in. But I started to experience back pain, fatigue, aches and pains, and it was 7 days exactly to the date that I got my taste and smell back.
Talk to us a little bit about post-COVID. Now you've had all these symptoms, you're starting to recover. How long did the recovery process last? Are you still recovering this many months later?
Still recovering. So after my 14-day quarantine, I did go back and retest negative. And then after that, I started noticing heart palpitations, the fatigue was still there, brain fog, body ache, hair loss. The fear of not knowing what my true long-term effects are started to set in a little bit more. And my endurance just went out the window. I was very active and worked out quite a bit, and I haven't been able to really get back to that.
Veronica, you had COVID. Did you get a vaccine?
I did. So I did the Johnson & Johnson vaccine. I'm 5 weeks post-vaccinated. And since then, I've noticed a lot of my heart palpitations, chest pains have resolved. I'm trying to rebuild my endurance, but I'm starting to feel more like myself before COVID. I still have a lot of the hair loss, but I'm just dealing through that on a daily basis.
So I want to kind of talk to the claims examiners here with your story. So you used to run how far a day?
I was doing 3-4 miles a day.
And now this many months out, how far can you walk?
I will walk without stopping. I can walk a half a mile.
So I think it's interesting to see and important to note that even months down the line, these symptoms last for a very long time. And it's not once you're over COVID, you're better. There's just such long-term consequences. Well, I want to thank you so much for sharing your story, because I'm sure your story is not unusual. I do want to mention some of the things maybe that people are experiencing. You had also experienced hair loss. Do you want to tell us what you're doing for that?
I've been taking collagen powder every day. I do 2 scoops a day, and just you wash your hair less and you try not to put it in a ponytail, but it's a struggle.
Leslee, some of the things that we also see that happen is people have things like a metallic taste when they get their taste back. How long does that last?
It's just an individual person. It depends. They can last 2 days, it can last 2 months, it can last a year. It just depends. And sometimes that metallic taste means there needs to be some blood work done to kind of see if there's something else going on.
I had a friend that had COVID, and he ended up with double vision, which is very rare. Doesn't happen to a lot of people, but he had to walk around with an eye patch on for about 6 weeks. He was a good sport about it, but it is something that happens. There are so many things that are unusual. Some people will have thickening of the blood. Some people will have the heart palpitations. Some people have extreme fear and anxiety. So I think it's really important that when we're handling claims, we realize that no case is going to be exactly alike. Well,
And
Veronica, go ahead.
also understand though, Diane, too, is that if a patient is got high blood pressure or a heart condition or a lung condition or any kind of medical condition, and then they get COVID, that can increase the situation and make things worse.
So diabetes, for example, might be a pre-existing condition.
Absolutely, but then you get COVID, and now you've got multiple different issues going on.
Especially if this is a contested claim, I think it's really important then to have all the medical records possible. We want to give doctor as much time as possible to answer any questions. So if you guys have questions for doctors, if you have any questions on some of the things that we brought up, please write them in the question box right now. Leslee, I'm going to let you introduce doctor. We'll let doctor do his thing. And I thank you all very much for your contribution to this webinar.
Thank you so much. I really appreciate it. Dr. Bondade is board certified in internal medicine and board certified in pulmonary medicine. He's one of our physicians here at First California Physician Partners. He's been treating all of our workers' comp patients with COVID and lasting effects of COVID. And we really appreciate him taking the time today to talk to us a little bit more about the signs and the symptoms of what happens after COVID. Thank you, Dr. Bondade.
Good morning, everybody. It's been almost a year more than a year since we've been dealing with this illness. Let me just adjust it a little bit, I think. And as we move forward, the biggest problem I'm seeing is the people who are having post-COVID symptoms. This has been coined as long haulers, long COVID, but recently NIH came up and labeled it as post-acute sequelae of SARS-CoV-2. And what this involves is if a person develops symptoms of COVID, 4 weeks after he has the symptoms, if he persists to have other symptoms along with the symptoms he had, or he develops some new symptoms after the COVID, then we call this as post-COVID sequelae or long haulers. And typically, this can happen in 10 to 20% of the people who have had COVID. And if you look at the population who are getting this more often, it's more men between the ages of 18 to almost 35, 40. These are young people who had COVID, who got over it, and they end up having these sequelae from the COVID, which persists for a long time. And if you look at the percentage, like 10 to 20% of the people who have had COVID and got over it develop this. And is there any particular people, like, people who are in ICU, are they more prone? Are the people who had mild symptoms? We have noticed that this can happen to anybody. Even if you had mild symptoms, you could still develop this sequelae from the COVID. People with severe symptoms may also develop. So this range, there is no fixed number we can say, you're going to get this or you won't going to get this. It's just, we don't know. It's a 10 to 20% broadly will get it. And the kind of people that I see most often is fatigue. Fatigue is number one. Almost 80% of the people that I see after COVID have fatigue. They are not able to get back to their level of physical activity that they used to do. And this persists for 3 months, 6 months. I have even had people who go on for almost a year. The other thing that happens is dyspnea. They are having difficulty breathing, cough, shortness of breath. This happens in almost 70% of the people who have post-COVID syndrome. And there is other things like joint pain, chest pain, rhinitis, red eyes, myalgia, lack of appetite, sore throat. Multiple symptoms can happen. And some of these symptoms may not be present when they had the COVID. So this is something that develops later. And when you look at what's happening, why are these people getting these symptoms? There are a couple of theories. We don't know exactly what happens, but we think in some people their autoimmune system has been dysregulated and they are responding to this COVID even after they have gotten better with this infection. 4 weeks later, you check them, they have no infection, but they continue to have these symptoms. So we think there may be ongoing autoimmune process that's contributing. Some people think there may be low-grade infection in them that keeps triggering these symptoms. And in some people, it's just not clear what's happening. But one thing we have noticed that, you may have heard earlier that when they get the COVID vaccine, it gets better. The reason we think that is they may have some ongoing infection going on, and when you get an antibody boost from the vaccine, it helps to fight the infection and their symptoms go away. I have seen this in many of my patients, who come in with long haulers, and I tell them, go get a vaccine. It's 3 months since you had your infection. It's time to get a vaccine, and sometimes that might help your symptoms. So there are things that the vaccine will help, not only to prevent it, but if you had any sequelae, sometimes it does help them. So we encourage them to get the vaccine. So this is the thing. And the question is, when they ask me, how long is it going to take me before I can get better? It's very difficult to predict, but we monitor them closely on a monthly basis. Sometimes I do pulmonary function testing, blood tests to see where their markers are, markers for infection, markers for our breathing capacity. And if I can see an improvement steadily, I tell them, you're going to be fine. It's just going to take some time. In some cases, we have had to do CAT scans, which shows persistent of infiltrates on their chest CAT scan, which means they may have long-term effects. And the other thing they ask me is, what can I do? Can you help me get over this? There's no definite treatment recommended at this time, but we have tried steroids. I have tried other medications that has helped them get over these symptoms. So that's just a brief discussion about the long haulers, because that's what I'm seeing more now than the acute infections. And I'm gonna see if you have any questions that I can answer.
Doctor, one of the questions was, can COVID cause blood clots?
Yes, definitely. Blood clots has been a major problem with COVID, and we have had many cases where we had to amputate their extremities due to the blood clot. So we normally start them on a blood thinner. Once they enter the hospital, we usually give them a blood thinner to prevent this complication.
Is there a percentage of people that will have a thickening of the blood or blood clots that have had COVID?
The blood clot issue happens usually when they are hospitalized. It's usually when the viral load is very high and their antibody levels are very high. When they're having acute infection, that's when we see most of it. And we start them on the blood thinner initially in the hospital, and over a couple of months, we'll just take them off. Within 3 months, most of them are off the blood thinners. And the percentage is, the more severe is the disease, the higher the chance of getting the blood clots.
Someone asked Dr. Bondade, have you seen any GI problems with post-COVID?
Yeah, post-COVID, we classify these symptoms by their systems. Like they have GI symptoms, they have pulmonary symptoms, they can have cardiac, neurological, psychiatric. So we go by different systems. And yeah, the GI symptoms are fairly common. They get like loss of appetite, diarrhea, loose motions like that. Yes, it is very common.
One of the other questions too on here was tendonitis for the ears. Is that something that can happen with post-COVID?
Yes, tinnitus can happen, vertigo. It's common to have these because the virus can attack any part of your body, any system, literally.
A question here, can long-time COVID-19 effects include rheumatology issues? She has an employee that complains of inflammation in their shoulder and back.
See, the inflammation of joints is one of the features of long haulers. So they can have, if they have an underlying joint condition, it will exacerbate. They will have more symptoms. They will have to take more medications to control those symptoms. Yes, it does affect.
And do the blood clots just in the lungs, Dr. Bondade, or they can have them anywhere?
They could have them anywhere. They could have stroke. We have had patients who had strokes from the blood clots, people who have had gangrene of our extremities and had to have their foot or toe amputated from blood clots. So it could happen anywhere.
Have you seen any feeling in feet post loss of feeling in the feet post COVID?
It can happen because it does affect the neurological system. And we have had people who had almost like a stroke symptoms. And yeah, they could lose sensory sensations in their extremities.
This is an interesting question. I'm not sure that you can answer this one, but it says, is it possible to develop a blood clot within 10 months of a diagnosis?
That's an interesting question. If the way the blood clots happen is they develop antibodies, and these antibodies will attack the platelets and they clog them up. If that's going to happen, it could happen, post-COVID anytime because they have ongoing antibodies. So it is possible, although I have not seen any of those.
This is kind of a psychological question. It's saying, what is the percentage of COVID patients that have experienced psychological breakdown that has led to a 5150 hold, which basically,
Yeah. If they have an underlying psychiatric problem, they have had schizophrenia or, any kind of a mental condition, it will exacerbate them. And it may go to the extent that their psychiatric illness is out of control. That can easily happen. Okay, so it is possible, yes.
Doctor, I have a question here. And one of the examiners would like to know if there is no objective finding for heart or respiratory issues, is there a chance that the injured worker might be embellishing their pain and their symptoms? The doctor even says that there are no objective findings, but the patient wants to remain at home under care of their doctor, even though that there are no findings. Is that something that actually could happen? Could a patient have problems without being able to be diagnosed with those problems?
That's an interesting question, because I had one of my patients that I was following through. The workers' comp people are saying, it looks like everything is coming back normal, but he's still symptomatic. He doesn't want to go back to work. And in my personal experience, very few people who had been working full time, these are all young people. They have families, they have all those. So they're really not trying to stay out of work. And if they are having symptoms, rarely have I find if 1% may be less, maybe lingering. But usually what I try to do is it is possible, but this is how I deal with them. I tell them, you are sitting home from work, you're not doing anything. I'm going to let you go back to work with the same restrictions. You're just going to sit at work, not lift anything, not do anything physical. Okay. Start with 4 hours, maybe 6 hours a day. So I'm going to push them back into the workforce. And once they get there, what I have noticed is all of a sudden they come back and say, I feel so much better. I want to go back full time. So the chances are, people who may not like what they are doing initially, they may be the ones that want to do something. In those cases, I send them to occupational therapy or physical therapy, where they can retrain and start to go back, because my aim is to get them back to work. This is not what they want to do. Personally, I don't think they want to stay home and collect the money. There are very few people who do that. Most people want to get back because that's what they are trained to do. And my job is to get them back as soon as possible and try to give them whatever medicine that I have, although these are not approved. Sometimes I use steroids. Sometimes I use an antidepressant just to get them back. So once they are back in the workforce, they usually come back and tell me, I want to continue, because I give them an option. You go and try it out. Okay, after 2 weeks, you come back and tell me you can't do it. Sure, I'll take you off. But I have not seen anybody come back and say, I can't do it. They usually say, oh, can I do a little bit more? So yeah, it is possible. There may be a few people who want to do that, but if you encourage them in the right way, you can get all of them back to work. And that has been my experience. I have not had anybody who had kept on lingering and going on, because if this goes more than 6 months and I reassess them at that time, do all the tests, everything, including psychiatric eval, and if they get to that point, I said, what, there's nothing much I can do. You may have to go back and find something else to do. So that's how we deal with them.
So, doctor, what if the injured worker who's had COVID for a long time has some type of rheumatoid issues, such as back and back injuries, inflammation? Is that something that happens in injured workers, or is that just something that somebody complains about?
Yeah, say somebody had lupus or rheumatoid arthritis, where they have had chronic joint inflammation and had been controlled with medications, and they've been back to work and doing their thing. Now they got the COVID. Post-COVID, they are the ones whose joint effects get worse, right? If they get to that level, I will send them back to the rheumatologist to readjust their medication and get them under control again, because we have markers for these inflammation. And if we see they are going up, we need to change the medication or increase the dosage to get them under control. And once they are back to their baseline, they should be able to carry on with what they are doing.
Well, thank you for that. What about a heart MRI? Would that help diagnose any heart issues that might have happened because of COVID-19?
The COVID cardiac patients mostly come with 2 symptoms that I have seen. Either they have palpitations or they have chest pain. Some people have shortness of breath, which could be either cardiac or pulmonary. So when they have these palpitations or the chest pain, we have specific tests that we do, including echocardiogram, Holter monitoring, to find out what is going on. Most of these are autonomic problems. That means it's their autonomic system has been dysregulated from the COVID. Like we have POTS disease where when their heart rate goes up when they stand up or when they change their position. This is mainly postural orthostatic tachycardia syndrome. So, these we can pick them up on our monitors and we can give them appropriate treatment for these things. Yeah. But the MRI, I'm not sure it's going to show any kind of damage because the virus does not leave a lot of scar tissue on the lung. Like in the lung, it leaves a lot of scar tissue, but in the heart, it's not leaving much of that kind of a scar that we can pick up on an MRI. We could pick these up easily on our tests that we already have.
And what type of test would those be, doctor?
Pardon? The test will be like an echocardiogram, Holter monitoring, stress test, nuclear testing. We could do those to figure out if there's any cardiac damage.
Okay, we have somebody who's asking about vision. Can it be affected? Earlier on, I mentioned a friend of mine that had double vision, had to wear a pirate's patch for some time. Can you talk a little bit about vision damage or issues because of COVID?
Yeah, it can affect any nervous system, and visual pathway can be affected from the COVID. If that happens, they can have blurred vision, double vision, any of these symptoms. If that happens, we normally send them back to the eye doctor to see what they can do to help them. Usually it gets better over time.
Well, that's good to hear. Vision is so important to all of us. I have a question here about a GI patient who has a loss of appetite. What would you do for that? And then in addition to that question, they want to know, what if you have somebody who's having difficulties eating and swallowing? What type of treatment would be advisable for that injured worker?
Yeah, if they have these GI symptoms, we need to look and see if they have something else causing the symptoms. Just because you had COVID doesn't mean you can't have an ulcer, from all the stress that you're going through, or you can have some other condition that's causing these problems. So initially we kind of take a deep history and see what underlying conditions they had before. And if needed, we could do an endoscopy, barium swallow to figure out if there's any blockage, anything that has happened. And that way we can assess the GI tract to see if there's a problem that we can correct. If none is found, most of these people gradually get over it. None of these are going to persist for too long.
We have another question about someone that may have scheduled a vaccine. They didn't know that at some point they had COVID. So if they have that vaccination, what might happen? What might be the consequences of having that vaccination with an undiagnosed COVID experience?
Yeah, because this has happened in the past. This is not a new thing. We have had people who got the vaccine, but they didn't know they had the virus. 3 days later, they did develop symptoms of COVID, and majority of them got over it. We tested them, they were positive, because it takes about 7 to 10 days, up to 2 weeks for antibodies to develop. So if you never had any antibodies and you got infected and you get a vaccine within the first 5 or 7 days when you are still asymptomatic, yeah, we don't know they had it. But once they get the symptoms, they really don't get as sick because their body has started to make antibodies already. So it's not a problem. I wouldn't be afraid of getting a vaccine even if I had gotten a COVID infection today. Okay, it's not a contraindication. Let me put it that way.
What about brain aneurysm? Can COVID cause a brain aneurysm?
Not that I know of.
Leslee, do you have any questions that you would like to ask doctor that you see?
Yeah, they're asking, are you seeing any PTSD as a common residual of COVID-19?
Yes.
And what are we doing for that, Dr. Bondade?
we need to send them to a psychiatric evaluation and management for those.
Another question is, are there specialists in Northern California willing to see patients with long-term issues? Sometimes we have trouble finding providers. And I will tell you, yes, we do have locations in Northern California, and we have internal medicine physicians up there that would be more than happy to see your post-COVID patients. Just get in touch with me, and I'd be happy to assist you in that. Let's see.
You know, as far as management is concerned, you know, with these people having multiple issues, most centers have developed a multi-specialty treatment centers where they have the primary care, they have pulmonary, they have cardiology, infectious disease, neurologists, psychiatrists, pharmacists, physical therapy, occupational therapy, pulmonary therapy. You know, they have multidisciplinary organizations that will deal with these hard to deal cases because some of them just don't get better, and we need to get them better as soon as we can. So this kind of a multidisciplinary approach helps to deal with these complex cases.
Perfect. There's another question here. Let me just get to it. I'm sorry. A patient that had COVID-19 in December 2020 had an upset stomach and diarrhea, but no upper respiratory symptoms. She has comorbidities of asthma and diabetes. She tested negative for COVID-19 the end of March of 2021 and received her first Pfizer vaccine. 11 days later, woke up with difficulty breathing, was transported to the hospital and tested positive for COVID-19. CT of the lung showed ground glass-like shards in lungs. She was diagnosed with pneumonia.
Is this related to the original COVID-19 diagnosis in December?
I know she had COVID-19, didn't have any symptoms, got the injection, and then ended up in the hospital with pneumonia after the injections. Are those related?
Yeah. The COVID vaccine doesn't give you 100% protection. We know that about, you know, at least 4 to 6% of the people who still have gotten infection in the studies that they had done prior to release. They did disclose this earlier, saying 94 to 95% will probably get infected, even in spite of the COVID vaccine. But what they found, you know, as the studies went on, is that these people never got really sick or died. But there are incidental cases, 1 or 2 cases, where people have gotten into the hospital with pneumonia and have gotten really sick. And the reason is their immune system is not good. You know, I can give a vaccine to 100 people. Over 94% of them will develop very good antibody response. But there are some people who may have problem with their immune system that they will not respond to the vaccine and they are prone to get infection. The reason she got a second infection tells me, plus she had asthma and other conditions, tells me that her immune system is not really that great compared to the normal. So she is a high risk. She got the infection in the first place, got over it, got the vaccine. In spite of those two, she didn't have enough antibodies to fight the third time when she got the virus in her system. So it does happen, but it's not common, and that should not discourage from not getting the vaccine.
You know, I hear this quite often, Dr. Bondade. There's a question here saying that some industrial clinics and SoCal are discharging injured workers, saying COVID is not an industrial injury, and telling them to exercise and diet. How do you feel about that?
That's, you know, because it's a lack of knowledge. The problem is this is a new disease. Many of us didn't know anything about it about a year ago or more than a year ago. as the disease got hold of the higher number of population, we studied, we looked, we kind of communicated with each other to figure out what is going on, what can it do, and what we can do to help them. And there are some people who don't believe in it. It's just like some people don't believe in the vaccine, and there are some providers out there, they do not believe it. They have this notion that this is another flu, it's going to go away, and so that's a problem. If I am a worker or I'm an injured person, and if I am treated like that, I would go somewhere else where I can get help. It's not that I can go back and work, because with all the symptoms I'm having, I may not be able to work, I may pass out again. So it's we need to learn more about this. It's a new disease. Nobody knows how common, what are the things, but if you have an open mind and look at the literature, talk to your colleagues, this is a problem. We're going to be facing this not just this year, maybe another 4 to 5 years. So I would suggest, have an open mind.
Doctor, we have a question here from someone that says they have an individual that has had pre-existing conditions, and they allege that COVID aggravated these conditions. Is there a way to distinguish between these two conditions and rule out the fact that COVID actually aggravated it, and that it is something that would have happened regardless of COVID?
The thing is this, if somebody has had back injury, right, and they in spite of the back injury, they are able to do their work, but one day they ended up lifting something unusually heavy than normal without any, I have seen this happen, you may have seen it too, where their old back injury gets aggravated by the newer injury that happened at work. So this still, as far as I'm concerned, it's still a work injury until you get him back to his normal where he was before. And it's similar to COVID. COVID can aggravate a lot of these conditions. And yes, if you get a good history, you know what their baseline was. If he had a baseline problem, he wouldn't be doing the job he's doing. So I assess what he was able to do and what he cannot do now. And I try to bring him back to baseline with whatever modes we have. Does that answer?
Yes, I appreciate that. Leslie, you have a question?
Yes, this is in regards to an aortic valve question. Patient was hospitalized with COVID pneumonia for 2 weeks, later developed severe blood clots and was on oxygen for 2 months post-hospital release. They want to know, are we seeing any aortic valve calcifications as a result of severe COVID?
As far as I know, the COVID virus does not attack the valves. It's not like the strep bacteria which do vegetate on these valves. The virus does not attack the valve. It attacks the cells that have a ACE2 receptor. That's where they bind, and that's where they do the damage. So do we have ACE2? ACE2 is present on all the cells, but the chances of it affecting directly the valve is highly unlikely. So I have not seen any reports of it affecting the aortic valve at this time.
But they said on there too that the patient was on oxygen for 2 months after they were out of the hospital. Those are two different situations.
Yeah. Oxygen is because they were not getting oxygenation because of the lung issues, not because of the valve issue. Valve will give you either heart failure, chest pain, syncope, that kind of a symptom. So they are, I don't know how I can connect both of them, but the oxygenation I can definitely say related to COVID, but the valve issue, I'm not sure I can connect it.
This question is interesting. Patient was diabetic, not on medication. He got COVID and now is insulin dependent. Is that possible?
Yes, we have seen people who never had diabetes develop diabetes after COVID. So it's not uncommon. And if somebody was type 2, which means they were not taking insulin, became type 1 to take insulin after the COVID, yes, it is possible. It can happen.
Perfect. We still have time, Diane, for a few more?
Yes.
Yeah, yes.
Okay. I have a patient post-hospital admission for COVID with subsequent ongoing congestion, shortness of breath, etc., and ongoing inhalers, developing fluid in the lungs, pneumonia, and is admitted for acute congestion. Acute congestive heart failure, I'm sorry. We are now responsible for congestive heart failure treatments. Is there any history of that?
Yeah, it can affect the heart, and then it can send you, you can have palpitations, heart failure. Those things can happen. I think the patient had such severe COVID infection that it did affect their lungs, which may have affected their heart, because the ability of the heart to pump may have been impaired due to the lung condition, and now they are in congestive heart failure. That is possible.
The patient's 36, by the way.
Yeah, it's unfortunate,
Age doesn't matter, right?
In the unfortunate. We
Doctor,
see a lot of younger people getting more sick recently. Initially it used to be the older people. Now we're seeing much younger people getting sick and going into the hospital than the older people. Older people have all been vaccinated and they've been protected. Younger people are not as much vaccinated as we would like to, and this is the sequence of that.
Dr. Bondade,
Doctor,
I'm sorry, Diane.
oh, okay. Well, we just had somebody who asked if there was some type of community where claims people or anybody in general would be able to go to share information on COVID, the type of treatments that were necessary, maybe keep up on what's happening with COVID and their treatments. Are you aware of a place that examiners could go to, share their experiences, and help each other out with their claims?
I'm not aware of any kind of a society or a web page or an organization, but I am more than willing to, if they want to email me their questions or their situations or anything like that, I can bring the doctor in and kind of give them, some suggestions and help them out. We'd be more than willing to help, because we are all in this together, trying to, see what we can do to make and help these COVID patients get back to their normal life as soon as possible and as normal as possible. I was going to ask Dr. Bondade a question. I'll ask you, Dr. Bondade. One of the things that I think that I get a question about is, when someone comes in here, what type of labs are we drawing and what are we looking for?
Mainly, I want to make sure that they don't have any underlying diabetes, kidney problems, liver problems, because these will all affect how quickly they can get over this infection. Number two, I'm looking at their inflammation markers, like we look at CRP, ferritin levels, SED rate, to see if how they are responding to this infection. And we do a pulmonary function testing. Sometimes we do a CAT scan, EKG, Holter monitoring to see where their baseline is. And once we have that, we follow them through to see how they are doing. If I see an improvement in their inflammatory markers a month or 2 months later, I know they are on the right track. If they continue to have the symptoms, I would give them some medications to help them get over the hump quickly. So that's what we're looking for.
Doctor, let me ask you, you've mentioned the vaccinations. We have several vaccinations here in the United States that are available. I know some people are very afraid to take the vaccinations. Some people feel like they've had COVID, so they don't need it because they've got antibodies. What is your feeling about the vaccinations and whether or not an injured worker or anybody in general should have?
I think vaccination is a good idea, but the reason is, you can get an infection and get antibodies developed in your body. That has happened to many people. But what we know is the kind of antibody response we get from the vaccine is better sometimes, because the vaccine is directed against the spike protein, which attacks the cells. When you develop an antibody against the whole virus, which is what happens when you get the infection, you have so many antibodies in your system. So sometimes it might hide the spike protein, so you may not develop this antibody that we want to develop. So when you get the vaccination, you develop specific antibodies against the spike protein, because that's the one the virus uses to get into your cell. If it cannot get into your cell, there's no infection. So we found out, they had some comparison in people who had natural infection and had antibodies, and the people who got the vaccine and had infection. They found out the people who had the vaccine had better resistance against the infection compared to the ones who had the infection themselves. So I definitely recommend vaccination. It doesn't matter to me which one you can get whatever one you can get. The sooner the better. If you had an infection prior, I would say wait 3 months and then at least get one shot, because some people I have seen who have had the infection before got the vaccine, the second shot, they had a very big reaction. So now the studies, now the studies are saying, one is good enough. It will boost your level up so much that you really don't need a second vaccine.
So is there any reason to be afraid of these vaccines long term?
No, because they are not, there's a lot of talk about they are altering your DNA, they are altering your, natural stuff. No, it doesn't happen, because the mRNA vaccine doesn't even enter your nucleus. It goes into your cell, makes the antibodies, and they are presented on your cell, and we deal with it. Our body deals with those without even entering into the nucleus. So there's no chance of damaging the nucleus or the DNA with these vaccines that we have available. So I'm not afraid. I got them back in December. My whole staff got it in December. Oh, we are fine. Nobody really got sick or anything.
What about, I heard that some people are concerned about the vaccine because they're pregnant or they want to be pregnant in the future. Is that a concern?
No, I had one of my colleagues here back in December. She was like 3 months pregnant. She was hesitant, but she took it anyway because it was so rampant at that time, and it was available. She took it and no problem. She took the second one, no problem. She's doing fine. And now the recommendation is, even if you're pregnant, because it doesn't go into your placenta. It just works with your immune system, and you are fine. You produce IgG antibodies which may enter the placenta and may protect the baby itself. So, there's no contraindication for a pregnancy.
All right, so let me ask one more vaccination question. And Leslee, if you have other questions, we can certainly ask that. But we are now getting to the point that they're suggesting that younger people should get the vaccination. At what age do you think vaccinations should start?
Personally, I think it should start at 6 months, right? But the vaccine is not approved at there. Right now, it's from 12 to 18 or 12 to, 12 to adult is approved so far. So as soon as they make it available to 12 to 18, I think they should get it. People who are 18 and above should get it. It's available for them. They don't have to make an appointment. They can just walk in and get the shot and go home. Yeah.
All right.
They should.
Leslee, do you have any other questions that came through for Doctor?
We do. They're asking, are you seeing a significant decrease in new cases?
Yes. The new cases have gone down, but unfortunately, the long haulers, we're seeing a lot more.
That's unfortunate.
Question is, it says question is, the news announced that heart issues for young children, but that's the news. What do you think?
I have not heard that. I'll have to check on it.
Okay. Some fully vaccinated individuals are showing symptoms of COVID. CDC says that there is a possibility a small percentage of people can show symptoms. Does that mean that vaccinated people can contract COVID?
They can contract it, but excuse me, but there is no cases documented wherein vaccinated people have transmitted the disease to other person. No cases. And there is no cases where vaccinated people have gotten sick enough to die so far. There may always, some cases will come up, but we've given out millions of vaccines, and yeah, we have had some side effects. We have seen some of the side effects, but chances are rare.
Perfect.
Well, Dr. Leslee, Veronica, I'd like to thank all of you very much for joining us today and sharing your expertise. Again, if you have any questions for Leslee or Dr. Leslee, can you give everybody your phone number? And Veronica, I'll ask the same from you in a second.
Sure, you can reach us at 714-428-6711.
And Veronica works for iLingual 2, which is a translation company. And Veronica, what phone number do you have that they can reach you at if they have any questions or want to place an order for that matter?
Sure, 800-311-8331.
Excellent. Well, I'm Diane Cohen with MacroPro. We are so glad that you joined us today for this program. Just a reminder that your certificate will be coming to you via email, and you should be receiving that from GoToWebinar within the next 3 hours. If you have ideas for webinars, we would love to hear them, so feel free to email me at Diane, D-I-A-N-N, @macropro.com. Until next time, we will see you later. Bye-bye, everyone.
Thank you.
Bye. Thank you.